Introducing the EpiNav. Anaphylaxis can be fatal in minutes, but up to half of those carrying EpiPens do not always bring them with them. I'm an EpiPen user myself, so this isn't just data to me. This is something I live with every day. Natasha Edan-Laperouse died on a flight after not receiving treatment in time. This led to Natasha's Law, which transformed food labelling across the UK. But even with even better prevention, reactions still happen, often in less time than it takes the ambulance to arrive. So in that critical window, survival depends on one thing. Is there an EpiPen user nearby? And currently there's no way of connecting these people.
To validate our model, we conducted primary research disseminating a Microsoft form here and via social media. The results of our study were transformative. 100% of people who surveyed this said that they would respond to a life-threatening alert. While 74% of the group carried an EpiPen, nearly half identified a real-time map of responders as the feature that would make them feel the safest. And 94% would trust an app to manage their pen's expiry, proving that this community is not just willing to help, but is actively waiting for this digital safety net.
Over 90% of the UK population now use smartphones. By creating access to adrenaline through building a community infrastructure similar to the defibrillator rollout in the UK, alternative initiatives and applications such as Good Time have increased cardiac arrest survival rate in the UK by rolling out a community-based application. EpiNav is a community-driven emergency network which is designed to bridge the fatal response gap through peer-to-peer rescue, public infrastructure improvements and smart integration.
This app is designed as a clean, minimal, NHS-style mobile service for emergency EpiPen sharing, built around speed, trust and accessibility. The first page you're met with is the emergency page, where in the centre there's one large, high-contrast red button. If pressed, a confirmation pop-up appears, giving you 10 seconds to cancel. If no action is taken, a siren starts playing, which you'll hear in a second. And nearby users are alerted to your position. A follow-up message is also displayed asking the user to call 999, and then once you've been attended to, you would click the I am safe button to stop alerting people.
The alerts page shows any nearby emergencies, including distance and active status, with a respond button that opens a route to the person in need. On the My EpiPens page, the user can add any of their EpiPens to the app with a lot number and an expiry date. The user can manage their registered pens with an expiry status shown clearly as valid, expiring or expired. And the user can also remove their EpiPens as they please. Finally, the Nearby Network page displays a map of the nearby users and includes a location sharing toggle which turns on automatically during any emergency. This page helps to raise confidence in the system among users. Overall, this design keeps interactions simple in high-stress situations, helping people access support faster when it's needed most.
Before implementation, key considerations must be addressed. Firstly, GDPR, we must ensure that no patient identifiable information must be stored, so it's only the lot number and the expiry date. Also, the device compatibility and connectivity to both iOS and Android devices, patient safety and clinical safety, cybersecurity, scale of application, and the expiry of pens.
To develop this project, we would partner with NHS GPs and pharmacies to enable relevant clinical and patient access, as well as have collaborate on securing funding to co-develop the app. Future development could include features such as a built-in barcode scanner to identify food allergens, expand EpiPen location mapping, including storage points alongside defibrillator stations, pharmacies and parcel pickup or drop-off sites, and drone delivery and supplies directly to healthcare facilities. Thank you very much.
The most sophisticated presentation I think I've ever seen.
Thank you.
NHS Hack time. Well done, well done. Can I just ask, there was one thing that you were showing me yesterday, that it was going to check if you'd ever had an EpiPen prescription. Did you drop that then, or you still had it?
It wasn't included because we were, that's sort of something that's NHS side.
Yeah.
So I'm using the serial number per EpiPen, so it has to be prescribed. to be able to enter it into the app.
So just to let you know that they have been iterating on this product definitely over the last 24 hours or so. Any questions? Rosemary?
It's fantastic, really, really good. Do you think there could be an unintended consequence of people relying on this as a safety net and therefore not carrying their EpiNav?
Yeah, well, yeah, we sort of covered that in the fact that this is absolutely not a replacement for the emergency services, and it is also not to emphasise anyone to not go without their
And maybe we
EpiPen.
should get Tally as the person in position to...
Yeah, so normally an anaphylactic reaction can range any time between 1 to 5 minutes. And the average ambulance time is 8 to 12 minutes. So this is just with the aim of getting the administration of the adrenaline faster than...
I think Rosemary's question was, are you worried, or do you think it could be a concern that people wouldn't bother bringing their EpiPens anymore because they could use this instead? Is that your question?
Yes.
I don't think with the risk of death people would do that.
Exactly. I was really going to answer for you, but I thought I would let you answer. Thank you. Any Asha?
Do you envisage this being standalone or being part of one of the wider apps that you mentioned?
We kind of imagined it being standalone, but like it wouldn't have its own sort of login. It would communicate with an NHS API and sort of store it as a token. I don't know if you've ever worked with Stripe, but when you save a card with Stripe, it saves a token rather than the actual data itself. So we wouldn't be storing anything apart from, I don't know, maybe like a user ID or something like that.
You.
I think I know where the last question was going to about how you can combine apps together, and some which are already established and got a wide distribution already. It's a fantastic thing. One of the question I had though was more to do with, let's say that you had, who's responsible for maybe a consequence of an unscrupulous individual who comes along with a needle and, well, okay, maybe something they've done to an EpiPen. I can't imagine this would happen. I'm not sure whether someone who's having anaphylaxis would really care, would they? But I mean, who's responsible then? I wonder where that would lie.
I think that would be murder, to be honest. I think it would be down to the person because they're the ones actually injecting, and I don't actually think you can get into an EpiPen. I think if you try, it just breaks.
And I think that according legally, the Goods from Maritime Law says anyone can actually administer life-saving treatment. So.
And I think just to add to that, we did say that for everyone who has an EpiPen, sort of the plan was to link it to their NHS profile, so we know who exactly.
Yeah, so they did consider